Smart ER uses a simple 1-2-3 process that is beneficial for both patients and staff. The patient attends the emergency department as normal and is booked in by and is triaged by the assessment nurse at the front door of the emergency room. Here they will explain their symptoms briefly, and the staff nurse and the triage nurse will determine whether the patient is suitable to be part of the Smart ER system. If this is felt to be appropriate, the patient will be given a full instruction letter to allow them to continue their 1-2-3 journey. If the patient requires blood tests and ECG, they will be asked to wait at point 2. Alternatively, they will move directly to point 3. At point 3, based on the instruction letter, the patient will be asked to enter in their details, and the system will authenticate the patient as having arrived at Smart ER and enable the patient to access their medical record. By allowing the patient to do this and asking the patient questions around their attendance at that time, the Smart ER system will collect all the information. They will be called through by the clinician, who will already have access to the information that the patient has imported into their own electronic patient record. The clinician then simply does a normal consultation with the patient, and instead of having to rewrite the patient story, simply agrees with the patient story if this is correct. The patient is then treated and managed as normal. We have seen that the delivery of emergency care currently is way behind the curve. What I mean by that is that all the patient's life has changed over the last 15-20 years. And the way the patient communicates with every aspect of their existence has been effectively revolutionized. But a patient coming to an emergency room now has the same experience as they did 30 years ago, 40 years ago, 50 years ago. So we need to change. And I think Smart ER brings the delivery of emergency care up to a current level of satisfaction from a patient's perspective, which is that they don't want to waste time. Their time is valuable, and we need to be able to use that patient's waiting time more effectively. What would be really great is if we can roll it out here in Doncaster, and if it can work here, it can work in Basildon, then I don't see it having a problem being applied pretty much in any emergency department.